Welcome back to the Chronic Pain Experience podcast. I'm so glad you're here because today's conversation is one I believe every single person living with persistent pain deserves to hear. If you've been dealing with stubborn pain, whether it's been months or years, there's a good chance you've cycled through the same routine. A diagnosis, maybe a prescription, perhaps a referral to a specialist, and then you're sent back into the world, still hurting and still wondering, is this really all there is? The answer is no, and that's exactly what we're digging into today. My guest is Cindy Perlin, founder of the Alternative Pain Treatment Directory, a resource dedicated to connecting chronic pain patients with the broader, more hopeful landscape of treatment options that exist well beyond what our conventional medical system typically offers. Cindy became interested in mind-body healing when in 1978 she suffered a back injury that left her disabled and in chronic pain for 3 years. None of the conventional medical providers she consulted were able to help. Cindy healed herself using many of the techniques she now offers others. She's passionate about the power of these techniques to heal. Cindy's also the author of The Truth About Chronic Pain Treatments, The Best and Worst Strategies for Becoming Pain-Free, and the creator of the Alternative Pain Treatment Directory. So this isn't about dismissing medicine. It's about expanding the conversation so that you can make fully informed decisions about your own healing. Cindy, welcome to the Chronic Pain Experience. I am so glad to have you here today.
Thank you for having me.
That's quite the intro. There is lots to cover today, and I could not be more excited to have you on today because I know we have a lot of overlap, and I'm pretty sure we hear a lot of the same things. And this first question deals with what we often hear is the belief that if an alternative therapy truly worked, my doctor would have told me about it.
I have to laugh at that one because here's the reality. Doctors really don't know much about treating pain. A survey of medical schools was done a while back, and they found that on average, in the medical school curriculum, doctors were taught about pain for 2 hours or less. Then they read journals that are funded by pharmaceutical companies. They attend conferences that are put on by pharmaceutical companies. A lot of their postgraduate education comes from the drug reps. In my book, I review the journals and how often they cover alternative pain treatments, and it's almost never. The main ones that, like New England Journal of Medicine or JAMA, the ones that are dedicated to pain, very little coverage. And a survey was done of primary care physicians at academic medical centers, and they asked if they felt competent to treat pain, and 66% of them said no. Your doctor's busy, overwhelmed, and doesn't have time generally to go off on his or her own and investigate these therapies.
It's so true. And I think that's where this huge gap lies. I do feel hopeful. I do see, for example, your website and the services that you give, and there are a lot of other providers, myself included, who are starting to fill in that gap, but I think we still have a ways to go. We do.
A long ways.
A long ways to go. So there's a deeply ingrained assumption that natural or integrative therapies are essentially glorified placebos, that without a pharmaceutical mechanism. Nothing real is actually happening in the body, is the belief. So what do you say to that? And what does the science actually tell us?
There's actually more science supporting alternative therapies than drugs. Just the reality that, for instance, I did a deep dive with AI into the research on different treatments, opioids, acupuncture, mind-body therapies. And it will surprise people to know that opioids are the least research supported treatment for chronic pain. And do you want to take a guess what the most supported? Mind-body treatment. And I printed out the statistics that I got. I don't want to get people too bored with statistics, but what I did was this very useful research app, AI app, consensus.app. If you ask it a yes or no question, it will actually come back with statistics for you. So I took 16 different chronic pain treatments and I said, is this an effective treatment for chronic pain? And it comes back with a graph that says this many reputable studies, peer-reviewed studies said yes, This percentage said possibly, this percentage said no. And I broke it down for all these different therapies. So for opioids, only 38% of the study said yes,
Wow.
possibly zero, mixed 19%, and no 44%. So when it comes to mind-body therapies, yes was 73% and possibly was 27%. No was 0%. So 100% of the studies said mind-body therapy either is or probably is an effective treatment for chronic pain. So there's a lot of reasons for that. It doesn't mean the pain's all in your head. The pain's very real. But the nervous system, your brain and peripheral nerves,
Yeah.
are affected by your mental state. And if you can calm that down, you're going to feel better. That's just the reality of it. That's the science of it.
Yeah, this is becoming such a huge conversation piece, and I'm so thankful because it's the work we both do, right? It is the work that is often the missing piece. And the sad part is that it's often, because it's the last missing piece, often we have a lot of people who are left in really bad places because they've tried everything. There's fatigue, and we'll get into that. But yeah, there's more that we can do. And I think that's the important part. And I think one of the hardest sells can be sometimes trying to convince people that the nervous system is such an integral part of the pain experience. Do you find that as well?
Yeah, I think that a lot of people are just, oh, that's just blaming the victim, saying it's my fault, I'm in pain. If I were stronger or whatever, that I wouldn't be in pain. And I get a lot of very nasty pushback sometimes when I talk about this stuff, but that's what made the difference for me. I was in terrible pain, disabling pain for over 3 years. I was only in my mid-20s. And I read a book about the mind-body connection that a friend recommended to me. And I investigated biofeedback, and within a day, I felt 50% better. And that 50% was because I was told I could have some control over it. Because I felt totally out of control. The doctors were saying, we don't know what's wrong with you.
Mhm.
You may be like this for the rest of your life, learn to live with it. And I didn't have a life at that point. I was in too much pain to do anything. I dropped out of graduate school
Oh,
and I couldn't work. I couldn't do anything I like doing, that I enjoy doing. It wrecked my relationship of the time.
yeah.
I didn't have a life. And that was just devastating. And then I went for biofeedback, which was offered by a psychologist in my area. And he said, if you do this, if you just learn to relax, it's going to make a difference. And he gave me a little take home strip that measured my hand temperature and
Mm.
said, warmer is better. And all of a sudden it was like I could get control of this.
Mhm.
And that made a big difference. And then just the physiology of stress and fear versus relaxation. Stress creates muscle tension, reduces blood flow, reduces digestion, reduces healing. So when you can calm your body, it makes all the difference in the world. And so that was my turning point. And I've used that ever since to stay better.
Yeah, amazing. It's a life skill, really.
It is. It's a
It is.
skill.
Yeah. And I think
Hills.
exactly, exactly. And I think an important part of this conversation is that we're not trying to swing the pendulum away from the biological issues that pain is, but more to put a voice to the psychological or the nervous system side of things, which has not had its time in the daylight, so to speak.
And there's a lot more. So I discovered a few years later when I developed foot pain that
Mm.
was really severe. And then I had surgery, and afterwards I had a different kind of pain that was worse. Could barely walk for 14 years. And the mind body stuff didn't help at all. That was because it was a structural problem that happened when I was recovering from surgery. And that had to be corrected. Like
Mhm.
I was walking on the side of my foot while I was recovering, and all the soft tissue shortened on the inside of my leg. And when
Mm.
I could put my foot down normally, it was really painful.
Yeah.
And no doctor could figure that out. It took me 14 years to find someone who understood that and could fix it. And mind body difficulty with moving forward in life was something that I heard that could affect your foot. No, it was structural. So sometimes it's tissues,
Yep.
sometimes it's your mental state.
Yep.
Sometimes it's a combination, and it's a matter of figuring it out and addressing all the parts.
And they're always intricately tied together. So even if it was a structural issue, there's still going to be a compounding of the psychological, right? With the fear and the avoidance and all the other things that come with pain.
Yeah, during that 14 years, which is a very long time,
Yeah.
there were times I just gave up on finding a solution and was just, trying to get by. And at least during that time I could work because I didn't have to be on my feet for my profession.
Mhm.
It was very difficult. And both of those times with my back and discovering a solution and with my foot and discovering the solution, I stumbled on it accidentally. It was pre-internet.
Yeah.
People get lost on the internet now.
Yeah.
And that's why I started the Alternative Pain Treatment Directory, because you can go to it and you can look at all the possibilities. You can look at things about your condition and what works. You can look at the different therapies and see if they're useful for your conditions and find providers and products that can help.
Which I promise I will leave in the show notes so that people can access that. Of course, I'm in there regularly looking at providers, just curious to see what's going on in the world. So it's a great resource for sure.
And people listening to this are providers who offer pain treatment. I'd love to hear from you.
I would love to get into a little bit more of the meat and potatoes around why it is that, and I understand why. I worked in the pharma industry for 10 years, so I've been in that world, but I provide more in the alternative world. Why is it that perhaps doctors are almost discouraging their patients from pursuing a more alternative approach?
I think part of it, as I said earlier, is they don't know anything about it. And the thing that they hear from the sources that they read or listen to is that there's really no evidence for it. And that's just so untrue. And even for some of the what would be considered the more woo-woo stuff, like hands-on healing, there's actually more evidence that therapies like Reiki help with chronic pain than there are for opioids. The evidence is stronger. And I have to put a caveat in there that what treatment works for you depends on your condition and your circumstances. So this is a very broad brush of chronic pain. Talking about there's different kinds of chronic pain, but doctors just don't know. And sometimes it's a competitive thing. The American Medical Association was sued in the 70s for trying to drive the profession of chiropractic out of business. Lied and said chiropractic is they're all quacks and they'll hurt you and whatever. And a lot of people still believe that.
It's still prevalent. Yes.
The AMA lost the case.
Yeah.
And went all the way up to the Supreme Court, and they lost the case. They were lying.
Wow.
And there's that anti-competitive thing of, I don't want you to go anywhere else. I want you to come to me. And I think that they do get incentives from the pharmaceutical companies.
Oh, yes, they do.
I had a family that the father was, I was working with the kid, and I also do neurofeedback for attention deficit disorder. The family was very upset that they had to pay out of pocket for me, but the father was an endocrinologist, and the mom was saying, oh, we're all going to Switzerland. And I said, really? That's great. Why are you going to Switzerland? She said, my husband prescribes a lot of this one particular drug, and the company is based in Switzerland, giving the family a free trip to Switzerland to reward us, right? And then they're complaining about having to pay me.
Oh, yes.
It's not covered by their insurance. So doctors do have incentives. They also have disincentives these days, which is they're afraid to prescribe opioids because of the number of people who've been getting addicted and the fact that the federal government has decided it's a criminal issue, not just for pill mills, but any doctor that prescribes a lot of opioids is at risk of going to prison for it. Doctors have been prosecuted and gone to prison. And even if they don't get convicted, the cost of defending themselves can wreck their lives and they can lose their licenses and whatever. So they're terrified. I'm not a fan of opioids, but I don't think that should be the response to a doctor who may be overprescribing. That's really a clinical issue, maybe a malpractice issue, not a criminal issue.
I agree. And the whole opioids thing could be a whole other topic of conversation in a different podcast, but it has left our community in a very tricky place, right? They're not being prescribed as readily, but they're also not being offered any other options. So I know one of the big barriers, and this is something I bump into all the time as a provider whose services are not covered by insurance, is cost and lack of insurance coverage are two of the most cited barriers to accessing alternative therapies. For someone who is financially stretched, which much of our chronic pain community is, what would you say to them about how to prioritize and where to start without breaking the bank?
I think that the mind body stuff is very important, and it's very critical to evaluate how stressed you are, how
Mhm.
much trauma you have in your past, and to address that. And there are free ways to work on that. You can go onto YouTube and find free relaxation videos. You can sign up for some free apps. There are different apps that are free trials or free for limited access. I think one of them is Curable.
Mhm.
So you can start there. There's a great little demo video on my website about demonstrating a technique. It's an energy psychology technique where basically some people do it with tapping, but I do it with just holding different places that are acupuncture energy meridians. And you can, if there's something you're really stressed about, you can calm down about it using this technique. You can focus on your pain, and if it's being exacerbated by your nervous system, it will help your pain. It will also work with healing trauma. You have an event in your
Right.
past that you just can't let go of. You have flashbacks about it, or you overreact to anything that reminds you of it. This little technique, and it's a 10-minute video, and maybe you can put the link in your description.
Sure.
It's just amazing. I've been using it since 9/11.
Ah,
I remember right after I learned how to do it, 9/11 happened, and it
yeah,
was useful in
yeah,
helping people, including me, get past 9/11 and
yeah.
the trauma of it. In my case, vicarious trauma. But yeah, so that's a place to start. Another place is with movement. Gotta move. If you're in pain, it's gonna get worse if you don't move. And I'm not saying run a marathon, but it doesn't cost anything to move. My latest blog that's gonna be published tomorrow is
Mm.
about swimming, back pain,
Yeah.
and it's also good for joint pain. Getting into a pool, and some community pools may be free access. The YMCA, some of them have scholarship programs. Getting in a pool is great exercise. Taking a walk, and some people have problems that make walking difficult, but start with a little.
Yeah.
When I first was recovering from my chronic pain, I was so deconditioned, I couldn't walk around the block. I
Mhm.
was so weak. But it's about getting out there and starting. When I had my back pain, I went to an osteopath who said, stay in bed and just come see me. And I stayed in bed for 6 weeks. I
Mm.
didn't do anything. And I was just so weak after that. And I
Oh,
got
yeah.
out of bed when I went to an orthopedic surgeon who said, don't do that. That's the worst thing you can do,
You're
get
right.
out of bed. But movement is, and that doesn't cost anything. If you want to hire a personal trainer or join a gym, it does. Changing your diet, eating less processed food, real food,
Yeah.
all those things can make a difference. Those are the basics,
Yeah.
and the basics don't have to cost you more.
That's right.
And then you build from there. If you can access psychotherapy through your insurance, or if you can access some Medicare plans, the Medicare Advantage plans will give you free access to a YMCA or some other kind of gym. If you're on Medicare
Yeah.
and you have a Medicare Advantage plan, that might be helpful.
And I think for those who are listening who are perhaps struggling with hearing us talking about just talking about exercise or movement, there are things we can do before we even get you to the YMCA to help you with the fear and that deep pain that comes as a result of just that anticipation of pain. So there's lots of things that we can do. And the best news is, Cindy, you know this from firsthand experience. We are a part of that equation ourselves. If we are the ones living with pain, we are very much a part of the recovery. We don't always have to wait for a professional to get this help. And I think this brings me to my next point. Sadly, because of the way that our care for chronic pain is currently, a lot of people are left hearing the words, there's nothing more we can do. You just have to, and you lived this, you just have to get on with your life. This is how it's going to be for the rest of your days. It's just that their suffering is simply inevitable. So how do you begin to dismantle that belief clinically, and what have you seen happen when someone finally is able to let go of that belief that this is it?
I think that's the reason I have the website, is because if people go to the website, they will find that there's so many things they never even heard about. And even in the last few years, even in the mind body therapy realm, there's new treatments. Some of the things that I do, they're a few decades old. There's new technologies being developed. I have an article on my website about how what conventional medicine misses about the human body. We're not just a bunch of chemicals and cells. We're an electrical system. Our
Oh,
body is an electrical system. Our brain has electrical activity, our heart, our nerves get transmitted on electrical energy. We respond to light. We have magnetic energy. All of this leads to therapies that heal.
yeah.
And then we have consciousness, which is part of what we've been talking about with mind body. Even conventional medicine only acknowledges consciousness in the sense of the placebo effect. If you believe something will work, it'll work at the time. But there's so much more to it than that. So there are so many things that people haven't heard of, new things, ancient traditions, but there's always something more. And there's a section on my website about inspiring stories. There's one woman who was in pain for 79 years and finally found an answer. A woman with 46 years of fibromyalgia who finally left it behind.
Yeah.
A man who was so disabled for 30 years, he could barely walk to the end of the block, who's now running ultra marathons, which is more than a marathon, longer than a regular marathon. There's a woman who's now a practitioner, and she had complex regional pain syndrome. And she went all over the world, spent $250,000. She said she didn't really have, looking for a solution, and finally came home and addressed her trauma, and that was the key piece. So there's just so many things that people aren't being told about that are out there that can really be helpful.
I agree. And that's why this podcast exists, because these conversations are so important. I gain nothing from these podcasts other than having great conversations and meeting new people. But more importantly, is passing on this message that yes, there is hope. If any community could use a little hope right now, it's the chronic.
Yeah, and it's hard. And I think that the conversation is getting lost right now for the most part. You don't see it in the news because
Yeah.
there's so many other concerning things happening right now that people aren't paying attention to this as much. The information is getting out there less than even usual.
Yeah. I would love your perspective here. So if you could architect the ideal care experience for a chronic pain patient, I have my ideas, but I know you have your ideas too. One that blended the best of conventional medicine with everything integrative offers, what would that look like?
I think it would look different for every person. I think there's a group that's training what they call pain navigators. I think it might be the US Pain Foundation, but I could be wrong about that. But I think that it's helpful to have a knowledgeable guide, and I offer that service where you have an extensive interview. You talk about what conditions you have, under what conditions they developed, what you've already tried, and what the impact was. And then it's a person who's really knowledgeable about your options and steers you to the things that are most likely to be effective. And obviously, we were talking about money before. That's going to be an issue for some people. It's not going to cost $250,000 to get well. I have an article about invest once, get years of pain relief. There are devices you can buy, like light therapy, pulse electromagnetic frequency therapy, microcurrent therapy, neuromuscular stimulation therapy, that can really be helpful. Massage, my favorite thing of all time is probably an electric massager. Came across that, one of the first devices I came across with muscle pain. I
Right.
think that's a must. So there's a lot of things that with a small one-time investment can take you through years and years of pain relief.
Right.
There are some things that are covered by insurance, like chiropractic and physical therapy. Copays can be a problem,
Yeah.
but having somebody who can act as a guide is really helpful, who can really spend some time getting to know you and
Yeah.
your circumstances, and then can help you, because it can be really overwhelming otherwise.
Yeah, absolutely. And that's, I think, the important part too, is it is such an individual process. Everyone's going to need something different and will have different results from different processes. So, but that's again where I think the power of conversation comes in. If you can talk to someone, yourself, myself, who can guide you through and ask the questions so that they can start to get a clearer picture, and then you can make informed decisions. There is such power in the ability to make an informed decision. And I think that's where your website's helping to fill that gap, is to know how many providers there are out there who can help guide. And I think that's really important.
Yeah, and we're going to a new idea that someone came up with that I love, is to have a badge on our website of which providers are chronic pain survivors. They really get it. If you go
Yeah.
to someone like me or someone like you, or
Yeah.
who's been through it, who's been through losing hope and having lots of pain, and then finally finding a solution and then offering it to the world.
Yeah.
I think it's great when you can find providers like that. And I'm not saying that providers who don't have that background can't have empathy, but I think that it does, it gives you that extra little thing that's very meaningful, I think.
For sure. Especially knowing much of this is daily practice, things that we live and breathe every day to help people through this. So I really hope I didn't miss anything. Cindy, is there anything that we may have neglected to mention that you think would be important for our listeners to know?
There's just so much, I don't know where to
Yeah, I
start.
know. It's so true.
But I think I want to echo what you said and what I've been saying, which is that there is hope. It
Mhm.
doesn't, you've been in pain or what your pain is.
Yeah.
There are so many things out there now. You just have to get informed and then find the right provider or product or whatever. But it's out there. Don't lose hope.
Yeah.
Just keep looking, look in the right places, and you can get better.
Absolutely. That's the mic drop right there. Thank you, Cindy, so much for this conversation. This is exactly why the Chronic Pain Podcast exists, because there are millions of people out there who are suffering not just from their pain, but from not knowing that a wider, more hopeful path is available to them. What you are doing through the Alternative Pain Treatment Directory is such important and necessary work, and I'm so grateful you brought your expertise here today. To everyone listening, if today's episode cracked something open for you, I want you to sit with that feeling of maybe there is more I can do. That is not wishful thinking, that is your instinct telling you the truth. And I want to make sure you have somewhere to go with that energy right now, because I've been working hard behind the scenes with my brand new website is live with resources built specifically for people walking this road. Here's what I want you to check out today. If sleep has become one of your biggest battles, and for so many people in chronic pain it absolutely is, the Sleep Rescue Program was created for you. Because nothing heals when you aren't sleeping, and you deserve real practical support for that. Or if you're in the middle of a flare right now, you are just trying to get through the day, what to do on your worst pain days is exactly what it sounds like. Concrete, compassionate guidance for the moments when everything feels like too much. And finally, if surgery is on the table for you, if you've made that decision, getting ready for surgery with chronic pain will help you walk into that experience as prepared, supported, and empowered as possible. All three of these resources are waiting for you right now. The link is in the show notes. Go take a look and find out what meets you where you are right now. And please, if this episode spoke to you, share it. Text it to someone who you love who is still searching for answers. Post it in a pain support group, send it to a friend